Hello everyone. Today I'm going to just discuss a few points regarding the past September exam. It was held 2 days ago. So I'm going to just discuss very few points regarding the exam. Okay. I will just wait for a few minutes that maybe some people, more people I mean, will join us. I'm going to record the session anyway, so do not worry about that. So people who miss the session can ask me for the recording. So I'm going to clarify important points regarding the exam. Is the exam pretty new or was it pretty tough? We will just rectify these points and we will see if it's totally different from the previous versions or it has some sort of deviation from the previous exams or not. Okay, we shall be starting. So what's new regarding September 2021 written exam? Of course, the exam pattern was new, but is it totally new? Of course not. People who appeared in the exam before know that the exam since 2014 is having SPQs. Usually it has like maybe 60% of SPQs and 40 MCQs. So in this exam, or since ADC announced it, that the new exam would be only and purely SPQs or scenario-based questions. So this is the difference, along with less number of questions. Okay, so people are having like 280 questions per the exam. Previously, it was like 320. So we have less number of questions. One of the most important points, and I have been always referring to that in my sessions, that they used to give very lengthy SPQs just to consume your time. I have been always telling people, you should manage your time, you should manage your stress. It's very important to manage your stress. Some people, in fact, they are very professional dentists. However, they find a problem in managing their stress. Actually, they are very good dentists. I'm talking about the practical and professional aspect. However, in the exam, they may ruin their exam. So it's very important to, regardless of the number of new questions, doesn't matter. If you have like 50% are new questions, 60%, it doesn't matter. Okay, first of all, you have to manage your stress and your time. If you don't manage your stress and your time, even if you have the whole exam as MCQs, not SPQs, it would be a problem. Okay, so the exam pattern was new, and fairly, nobody can deny this reality. I like to be very realistic. The exam pattern is new, but we have a good idea about SPQs. In the past few previous exams, you can find that ADC has mixed many SPQs together, many questions together. This happened all over the past 2 years. So it was very clear that they are going to mix or make a new mixture of different questions. It's about clusters nowadays. It's not about paper 1, 2, 3, and 4. It's about clusters, professionalism, and treatment management and evaluation. Okay, so they changed the frame of the exam. However, the same basics shall apply. Okay, so the exam was new. As I mentioned, nobody can deny this reality. Every mentor, I believe, I myself, nobody can expect the same questions of the exam unless he has a copy of the exam. Okay, so this is very important. Nobody can expect the exam question typically unless he or she has a copy of the exam. So, of course, I'm not the one who have a copy of the exam, and I believe no one has a copy of this exam. So, I'm just trying to expect and anticipate what's going to happen in the past exam. Okay, second point, though from the very beginning of ADC announcement regarding the new pattern, I refer to important points to be well considered. I want you all to pay attention. Whatever, this is what I mentioned many times in my sessions, in the compiled file, in many situations. I just mentioned the same, and I repeat because I know people forget, so I'm repeating. Point number one, specific books like Clinical Guide to RPD. And at that time, I referred to the most important part, which is RPD design, Kennedy Classification. And that was a complete SPQ in the past exam, I mean September exam. We consider it past now, even if it's in the current month. I'm sharing some screenshots from the Mega Group, which is a private messenger group for people who are receiving direct coaching from me. Can you see, this is a screenshot. This small book is clearing a lot of doubts regarding RPD, and it's recently added to the list of books. Please study that. Okay, so I referred to that book, especially the RPD design. It's very important to study the RPD design, and you can see that there was a complete SPQ about Kennedy classification. If you simply study Kennedy classification, you know the modifications, the different classes, it's not a problem at all. Okay? The new classification system of periodontitis grading was already involved in my compiled file long time ago. I didn't give this grading like few months ago. No, it was given maybe since 1 or 2 years. And there was a lot of questions regarding periodontitis. So framework for grading, staging and grading, these are all already given in the compiled file. I always like people to be up to date. That's why I'm giving this information, even if it's not in the exam. At least people are aware of the new updates of dentistry in general. Okay, the code of ethics and conduct were already given in the Mega Group. ADC asked around 4 or 5 questions regarding professionalism based on these documents, and the answer was the same for all. So there's a question. So if you have like 4, 5 questions, 10 questions, whatever the number of the questions, should you give the same answer every time? You have like 5 SPQs, and in every SPQ they ask the same. So should you, in every time that you answer the same answer? Yes. I literally say yes. You can answer the same answer. And this is sometimes considered a trap for many people because they logically think that it's not logic at all that we would have the same answer for every question. But fortunately, ADC give these kind of questions. You can find the same answer for different questions in different papers or different clusters. Okay, this is very important. So please don't depend on the logic here that they are not going to give the same answer for different questions, but rather go for the same answer as long as it's very professional answer. So ADC asked around 4 or 5 questions regarding professionalism based on these documents, and the answer was the same for all these questions. In this regards, ADC wants to see who understands how to deal with integrity with patients and colleagues, as it's not at all acceptable to discredit your colleague to gain the patient confidence. Again, it's not acceptable at all to discredit your colleague to gain the patient confidence or to make the patient comfortable. It's not accepted. Okay, so you have a basic in your mind. Once you have a basic, it doesn't matter how they change the question, how they, you see. So we can have in so many questions since I started coaching, online coaching in 2017. I have been always telling that whenever they remove this answer, there should be best second answer. You can find this in many situations in the compiled file, in the past exam questions. So always, guys, be ready for second best answer. And please depend on the logic. Okay, try to depend on the logic. Use your logic. I would just mention some point regarding the logic. Okay. So this is how I referred on May 27. I think after ADC announced it regarding the new pattern, code of conduct, code of ethics, that it should be well studied. Okay, the fourth point, in my mock test, I gave some important questions regarding COVID-19, and I consider them, these are the most important ever regarding COVID-19. And fortunately, one of them was almost the same in the exam. This is the question of my mock test, which is about a 60-year-old man presented at your practice complaining of severe pain in tooth 1/6, which kept him awake for the last few nights, and painkillers don't help. The patient told you that he is recently diagnosed with COVID-19. The word recently. Always, I have been recommending everyone, please focus on the keywords. Keywords are the ones which does not consume your time in the exam, and of course your effort. So once you have a keyword, the word recently, this is considered an important keyword. So once you see it, you see in which stage you should deal with this condition. How would you best treat the patient? Prescribe stronger analgesics, which is not correct. Conduct pulpotomy initially, start RCT, cleaning, shaping, extract the tooth. This was in my mock test. And I think I made this question maybe in June 2020 after the COVID-19 took place or hit the whole world. So this is a question or a very close form of the question of the exam. Your clinic is in the red code of the COVID area, currently in lockdown stage 2. Patient come back to pay the rest of the money he owed from the previous extraction. And he needs another extraction. Radiograph shows lower first molar with extensive caries with necrotic pulp. No apical lesion yet, not mentioned he is in pain or not. What will you do? Okay. Of course, there are many questions. I already compiling the brainstormed questions nowadays. So there are very similar questions to the previous one. I mean, the mock test one, almost very, very close form. So I'm just trying to expect what's going to happen in the exam. Okay. Now we have like a complete picture regarding the exam. But at least we have few points which we refer to, and actually they were in the exam. Everyone who pay attention to every single word in the files or in the sessions, I believe he or she must pass the exam. Okay, the new pattern is about basics rather than memorizing answers of questions and just going to exam and pass. Unlike the previous pattern. In the previous pattern, you can simply just you have the compiled file or some just few files and the past exams. I have some experiences like this. People who just studied for 15 days and just only the compiled file and past exams. There are some examples, but they are few examples of people who did that. But this is not the rule, okay, for the previous exam. So you can see one of the comments of our colleagues. Overall, the exam is more on basics. Most of it is similar scenario from compiled file, but in a revised new form of question, a new form of answer option. If you concentrate on the basics and know all the basics, then you would be fine. This is a very fair comment regarding the exam. Of course, I received some similar comments like this. This was one of my comments just previously to the exam. So usually after exams, some people tell me that their question were the same as the compiled file, other till they were a bit twisted, and third kind of people tell there were pretty new options. So I know they are the same question with same basics, but some people understand the main principles, others unfortunately not, for different reasons. Of course, there are some personal reasons, but I'm giving the same benefit, the same paper to everyone. This is one of the feedbacks from one of our colleagues who received direct guidance, and he can say that it was tremendous amount of work and effort and support regarding the materials and the notes. So as you can see, all the recommendation notes sources are exceptional and to the point. And he says that he's sure that without the compiled file, it would have been a whole different story. I'm trying to give the positive aspect regarding the exam. And I would mention finally the study plan. So previously, maybe in 2 weeks time, before the exam, I give this question. What will you do first read? There was a question, and the question, it has different forms. In a form, you can just see Explorer staining with Explorer, Fisher sealant, X-ray, Bite-wing, fluoride application, and you have the same question in a different form. However, they give it like you will just take intraoral radiograph. So X-ray, Bite-wing in this question is the same as intraoral radiograph. You understand the basic, you apply the basic, and that's it. You can see a simple shifting from exam to another, or even from a candidate to another, though the basics is the same. Just intraoral radiograph. Just on the first day of the exam, I sent an important point for tomorrow. I mean the second day of the exam. Always do what's legally and professionally right, even if this contradicts with the patient interests. Somebody is annotating. Please don't annotate. Okay, please don't annotate. Okay, so always, this is the rule. Do what's legally and professionally right, even if this contradicts the patient interest. There was a question like this, and the patient wants to make something which is considered is not legal, is not right, either professionally or legally. So you can't tell the patient, okay, I'm going to do that thing. It's not acceptable at all. It's not ethical, it's not legal, it's not professional. There was a question like this, that the patient is having like a cracked or chipped bridge, maybe a bridge or crowns, and the patient want to have the insurance and so on. So this patient wanted something which is not correct from the dentist, and he said that if you don't make this for me, there is some other dentist who is going to do the same for me. So you have to deal professionally. Professionally means you have to consider the relationship between you and your colleagues. Okay, you can't step up and go for you tell the patient to go for the ADA, for the opera, and you see, this is not acceptable. You have to firstly deal with or contact the dentist, the colleague dentist. Okay, this is how to protect the integrity of yourself, of your reputation, and of course the reputation of dentistry in general. According to some candidates, the estimate number of past MCQs which ADC used under the SPQs in the new exam is around 40 to 50 questions out of 280, which is a huge number, and I already referred to that in my mega group. Okay, this is what I mentioned in the mega group. This SPQ is a self-made and simply shows how they might mix SPQs together at the same time they gave MCQs underneath. Can you see? These all already referred before. So what is the best cantilever bridge designed for a missing maxillary canine? This question is already given in COSN. By the way, we are not going to study COSN, the 1000 MCQs anymore, Boucher is already omitted in our previous study plan. So this is an example of the question. It's just an MCQ, but they can just use it under any of the SPQs. So I'm trying to give a clear picture about the exam before people went to that exam. I try to do that. Okay, the seventh point, sometimes we need to use some logic. Of course, we have the logic. Everyone is talented enough to exclude options, to see that this option wasn't fair, wasn't correct, is not close to the answer. We just use some logic. So these are examples for logic question. What it's about a limited patient with a patient with limited mouth opening, and there was TMJ clicking. So the question is about the best radiograph to investigate the problem. It's about clicking. So if you read the Australian Dental Journal, it's clearly mentioned, maybe in the edition in 2016. It's mentioned there, in case of internal derangement, the best should be magnetic resonance imaging. So it should be MRI. CBCT is very good. However, MRI is considered superior. At least it would have no X-rays at all. CBCT has some sort of X-ray. MRI has no X-ray. So is this considered a super advantage when compared to that? Okay, this is one of the logic question as well. How many finger we put in the patient mouth to check opening mouth in case you will take intraoral radiograph? IOPA, which is periapical X-ray, or you will take bite wing. So we have a rule here. We have a basic rule, which is we should never hold, we as operators or dentists, we should never hold the film for the patient. Okay, we take the X-ray, but we should never hold the film in the patient mouth. So don't tell me that I made it incorrectly and just I showed 2 fingers or 3 fingers of the patient, of the operator. I mean, it has to be 3 fingers of the patient. Let me tell you the truth. If I'm in that exam, I would just try it by myself. If I see this question for the first time, okay. If I see this question for the first time, I will do it by myself. I just will open my mouth. I will put 2 fingers, and I would find that it's very limited. Okay, so it can be 2 fingers. So this is logic. This is an easy way of thinking. Just think out of the box. So you would exclude the operator for sure, because he or she will not put the fingers inside of the mouth, and at the same time, you just focus on the patient fingers. So when you put 2 fingers, you would find it's limited mouth opening. So it's very easy after that to exclude all the options except for 3 fingers of the patient. Sometimes logic is amazing. We need some logic. Okay, this is my new study plan, which is the final point regarding my session today. I amended some books, I removed others, and I give some just few new ones. So therapeutic guidelines 2019 would be the one which should be studied. Odell, as you know, we are just studying specific cases. Cameron, as you know, we are studying specific chapters. Langal is the same, like panorama, periapical errors involving specific pages of Langalis. Walton is the same. Infection control guidelines, but this time we would study the 4th version. I know ADC did not announce that yet, but I believe that they are going to announce about the 4th version anyway. So we would study the 4th version. Radiation protection, Mount and Hume, the same. Carenza, shortcuts regarding pulp therapy, Evans articles, and of course the past paper exams. I personally believe from my experience that they are going almost, somebody was asking me yesterday how you are sure about it. It's just through experience. It was a new exam. However, by experience, we can see that all over the past 7 years, they are just repeating the same exams. They are just giving like 30 or 35%, which are pretty new questions, but the rest are repeated. So from our experience, we can see that most probably they will repeat most of the exam questions. Of course, they would mix some SPQs, and this is considered habitual, as you can see. Code of ethics, code of conduct, clinical guide to RPD, and no more Boucher, Coulson, Little, and Fallas, or the 1000 MCQs. We will not focus anymore on these topics, okay, because they are focusing on the very clinical part, the very clinical aspect of the dental career. Okay, I would like to thank to every one of you. Feel free, if you have any question, if you have any query, please don't hesitate to contact me regarding the new pattern and regarding if you have any questions. And finally, my group course would be starting on the mid-November. Okay, so by the way, the study plan nowadays, you don't have to study even for 4 months, just 3 months is pretty sufficient. Although the exam pattern is a change, but I believe that's 3 months time would be great for exam. However, I recommend everyone that you start this as soon as possible. Okay, so don't just take it like, okay, Peter said that we are going to study for 3 months, so you just think about you have finished your initial assessment or you appeared before, and because I said that just 3 months is sufficient, you just go for the exam and you are not preparing from the beginning. It's not recommended. If you are already preparing even from time to another, it doesn't matter if you are graduating the last year or even 20 years ago, it doesn't matter. Okay, what matters that you stick to the points, the important points, and the basics. Thank you very much, and have a good and good results. I wish all the best to everyone who appeared in the past exam, and I wish everyone the best of luck who are appearing in the coming exam. Thank you very much.